and just pause there for me for a little bit? Yeah, bro. Yeah, bro. That maxilla needs to come forward, without a doubt. So this is really the crux of the conversation here, is that you have to be careful, bro, that they don't cut that lower jaw and bring it back and make your airway even worse. Yeah, you would look more normal, right?
Yeah.
Because your upper and lower jaw would be coordinated, albeit they would both be recessed now instead of just the upper being recessed. But why bring the lower jaw back when you could just bring the upper jaw forward?
It's not worth it, is what you're saying.
It's not only not worth it, it's ass backwards. It's ass backwards.
Because
they're just making your airway smaller.
I knew a girl who did it.
All right, Jason. So we're recording now. Where are you calling from?
So I'm calling from Toronto, Ontario. So I'm in Canada.
Nice,
That's probably my first question for you to get right to it.
Mm-hmm.
I have no idea how to get MSE where I'm at.
Mm-hmm.
So I wanted to ask you, well, before we actually get to that, we should probably look at my malocclusion or whatever you say.
Yeah.
So I actually have a class 3 underbite. Asymmetrical on this side for sure.
What do you mean by asymmetrical on that side?
So one side, at least from what I can notice, I'm not really sure what side it is like more developed, I'd say, my mid-face. It looks less like I have an underbite on one side than the other.
Which side is the more developed side?
I'd say my left side.
That side?
But I could be wrong.
Can you smile big for me? That's your smile, huh?
Yeah, that.
That's pretty bad. And can I take a look at the roof of your mouth? Seems like you've got a lot of teeth, though. Have you had extractions? Doesn't look like it.
I've gotten my wisdom teeth removed.
Yeah, just the wisdoms, right?
And then when I was younger, this tooth right here.
I can't see it. Come back into the frame. Yeah,
Right
which
there.
tooth? Yeah, the canine?
It didn't come in properly, so I had to get it kind of yanked down. And
with
restructured.
braces?
So I had braces on my upper teeth.
Mm-hmm.
I never got them on my lower teeth. And then over time, I'd say they shifted. Just as a result of my bite, my teeth kind of come together. They've kind of been grinded down, I think is the right way to describe it. So I had braces. The result of them didn't really last too long because my teeth just eventually got unaligned.
And have you had an underbite like this your whole life?
So I've had it at least since I was like 12.
And how old are you now?
I'm 20.
You're 20. Really,
Yeah.
man? Wow. Yeah, you seem older than your age.
Yeah, definitely.
Good, man.
But,
good. Yeah, man. When all is said and done,
when
all is said and done, you're going to be in good shape. You've got a lot of good features. You've got a nice looking lower jaw, some sharp features in your face, nice eyes, nice eyebrows. You're going to be good. I mean, obviously your bite is banged up.
Like honestly, yesterday my grandmother noticed it for the first time because for a long time the orthodontist was like, "You're a weird case. You're able to disguise it well." I don't know if you've heard that, but for a long time, like when I'd shut my mouth, people wouldn't be able to notice that I had an underbite. Which is weird. I don't know anything about that. But
I mean, my first impression of you when you got on the call was like, "Oh, this is a good-looking dude. I wonder what he wants to talk about," you know. But then when I saw your smile, I was like, "Whoa," you know.
Yeah, like my grandmother was concerned. She was like, "That looks painful." It's not painful. I don't even have TMJ. Like I'm maybe like a miracle case because I know people who get underbites have like serious TMJ. But the only thing that I have is when I open my mouth as wide as I can. So like, do you hear the click?
Oh yeah. One more time. Oh my gosh.
And so
That's gnarly, dude.
it doesn't even hurt. And like the worst thing that's happened to me, I don't know if you've heard of, like I know you're Buddhist, I believe, right?
I was training to be a Buddhist monk, but I'm now more of a Christian. But yeah.
Sweet. I've been very interested in the religions as well. But,
Yeah.
We can get into that later on.
Sure. I wish we had more time.
Of course.
I think we've only got a half hour, and I've got one right after you.
We'll get right to it.
Sure.
I was doing this thing called bioenergetics. It was like big on YouTube. If you know Elliot Hulse, he was kind of saying a lot of us carry muscular tension in our bodies. We got to find a way to get rid of that. So it's a lot of just like expanding your face, like shaking, getting rid of muscular tension.
I'm about it.
Expanding your thoracic spine, opening your airway as much as you can. And so a lot of that entailed like opening your mouth as wide as you can, stuff like that. And when I was doing that, my jaw at one point locked. And so like that's the only case of like serious TMJ symptoms that I've had is like 2 times I did that and my jaw just completely got stuck open. I thought I was like dying.
How did you get out of it? Did it just let itself go after a while?
I had to just go like and like bite down and just fucking fix it. Like,
Shit, man. Shit.
Yeah.
It's like you dislocated it and then you snapped it back into place.
Exactly, I guess.
So, what issues does your underbite give you in your everyday life from a practical point of view, or are you coming at this exclusively or primarily from an aesthetic point of view? Of
course, the aesthetics are important, but what I should get to is the fact that like some nights I'll get sleep apnea. Every once in a while, I won't even say some nights, like maybe once every couple months, I'll like wake up and I would have had sleep apnea. Usually that may be under times when I've been stressed, I wasn't eating right, stuff like that. But other times, like I just know that I'm like usually mouth breathing at night. I've tried the taping, I'll wake up and the tape is off my mouth. So like it's more function. I'm like just trying to get my breathing right. And like I've kind of learned that to mew properly, and I've gotten decent at mewing. Like that exercise you posted, you pinned my comment. I was like, this is crazy. I finally got my like tongue in proper posture, and I never got it there before.
Hell yeah.
But what like my main goal is just to get my breathing proper. And of course, like if you know about the muscle fascia, how like the roof of the mouth is kind of like an arch. Have arches in our feet, our hands, and the tongue, the maxilla kind of activates muscles in the neck and in the chest region. And so I'm trying to get all of that as proper as possible just because I would benefit from it.
Good. So you're looking for aesthetic and functional improvements.
Exactly.
I mean, dude, with a bite like yours, there's really no explanation needed for why you want it fixed. It's like, well, my arm is broken. Well, I would never say, oh, well, why do you want to fix that, right? It's like, well, because it's broken. Yeah, I mean, it's self-evident why you're looking for some sort of intervention. I mean, that underbite is completely unacceptable for a million different reasons. And it'll get worse before it gets better.
If you wanted to actually explain like what would happen if I didn't get it fixed, if you have any idea. I know you can't actually say for certain, this is not medical advice, but like give your best take.
My best take? I mean, your sleep apnea issues will continue and probably get worse, right? Your inability to mew will cause that to just continue to collapse over time. Any stress that your TMJs are under will be exacerbated with time as the bone in the joints resorbs from incorrect forces being placed on the joints by the placement of the condyle in the joints. Just whatever airway issues you have will continue to get worse. Whatever aesthetic issues you have will continue to get worse slowly over time. I mean, it doesn't seem like a crisis for you. I think you could probably survive like this.
Of course.
Indefinitely. Yeah, right. I mean, you've made it this far. You seem like a pretty well put together dude. But yeah, I would just say a gradual decline in all of the areas where you're already struggling.
Okay.
Hey, yeah, your video just went out. But
I just had to. I got a notification. Had to
okay, all right, all good. Okay, so do you want to transition to? I imagine you want to talk about what can be done about this.
Exactly. So I don't know if you have any experience with dealing with clients from Canada.
I
From
do.
what I've looked into, I have no idea how to get an MSE here. I'm like thinking I'll have to go to the States and do that.
So let me pull up. So I have a few different sources for looking for MSE providers. Let me just pull up the first. Canada. So what state in Canada? You said Toronto, right?
Yeah. So Ontario.
Ontario. So I have a gentleman named Mark Luden. He's in Ottawa. Are you anywhere?
Mark,
Are you how far?
I could get there. It's like 8 hours away. If you don't mind, I'm gonna type it in on my note.
So there's another dude. His name is Sylvain Chamberlain, and he's in Quebec City.
Mm-hmm.
Sylvain space Chamberlain, Chamberland. He is one of the unicorns who does MSE, and he's a dude who is not afraid to involve surgery along with MSE, which I gather is something you'll probably need. So let's step back. To fix you're either going to need an MSE with a really powerful face mask complement. So you'll do MSE with the face mask. Or you'll need maxillary advancement via orthognathic surgery. In other words, some kind of double jaw surgery. Okay?
And so
when I say,
curious,
yeah, go ahead.
I don't want to go through the face mask. It's just, I just don't want to do it. But
fair enough.
So you're saying the best option would be, well, I remember believe the first interview that you released, I don't remember the guy's name, but you were telling him that like usually you would recommend people go with the surgery instead of the face mask.
So in a case like yours would be one of the few instances, basically an underbite is one of the few instances where a face mask is appropriate, where it's like clinically, traditionally, a face mask would be used to correct an underbite. Because here's the problem with face mask for someone who's just generally underdeveloped, like the gentleman that you're referring to, Hayden. Face mask pulls on the upper jaw, but it doesn't pull on the lower jaw. And so for someone whose upper jaw and lower jaw are even, if you just pull the upper jaw forward, and the lower jaw doesn't reposition itself forward automatically, which it won't in most cases unless the TMJ is unless the lower jaw is super recessed and the TMJ is having issues, then that's not a stable position. You'll pull it forward, and then like an elastic band, it'll just fall back because there's no lower jaw and lower teeth that come forward to support it in that new forward position. In your case, completely different. You would pull your upper jaw forward, and then because your lower jaw and your lower teeth are already in a forward position, once the upper jaw was brought forward, it would be stabilized in that advanced position by your lower jaw.
I would need to bring it over and up, or like over and angle it. Like I believe that's what I've seen from the mewing community, is that just bringing it forward wouldn't be enough. I kind of need it on like an angle. Is that true?
I mean, so that's a more subtle question, and ideally there would probably be some counterclockwise rotation in the final positioning of your jaws. But with a face mask, it's just not really possible, as far as I know, to be that precise with angulation. Like, face mask is kind of a brute thing where you're just kind of pulling shit forward, you know what I mean? If you want to start getting into angulation, that's more in the domain of orthognathic surgery, double jaw surgery, because the surgeon can cut both jaws and angle them both in whatever position he wants. If you were to do face mask, it would just be like, let's pull this forward, let's get those upper teeth in front of those lower teeth, and let's, stabilize in that position. Which is one of the reasons probably why you're leaning toward towards surgery anyway is because you don't just want to pull things forward at whatever angle they're already at. Maybe you're looking for some kind of counterclockwise rotation anyway, which is what you would get with surgery. Am I wrong that
so
what
I
I'm
wanna
hearing?
do
Yeah, go
No,
ahead.
you're not wrong at all. I want to do a bit of a like cost benefit analysis. So
Mm-hmm.
like, what are the cons of doing the face mask?
Slow, pain in the ass, weird, ugly.
How long would I be wearing it daily, if you have any idea?
As many hours of the day as possible. I mean, ideally 24 hours a day,
Yeah.
right? It's one of those things where it's like the more the better. But it's not feasible to do it 24 hours a day. So I think normally, what's recommended is a minimum 12 to 16 hours. So basically when you're sleeping, and then any other hour of the day that's possible for you to wear it, you'll want to wear it.
And which one would you say would consume more time?
Oh, absolutely, the face mask.
Okay.
The double jaw surgery, you go in and 6 hours later or whatever it is, you come out and you're a new man. Face
So, of
mask,
course, yeah.
face mask, you're going to be pulling for 6 to 12 months.
And so, of course, the risk for jaw surgery would be worsened TMJ, possible nerve damage, stuff like that, right?
So let's be specific, right? Like, because this is a huge issue. Is the reason people do all this insane shit to avoid double jaw surgery is because they're afraid of the risks, right? So, and you see it all the time. People doing these insane tooth-borne appliances that go for years and years and put their teeth in all these insane compromised positions, all because they're afraid of surgery and the risks involved in surgery. So what are the risks? Permanent numbness in your chin and your lips, right? Yeah, it's possible that nerves will get, will become collateral damage of all the bone cutting that's involved in double jaw surgery. Definitely it's possible. I mean, I've had peripheral nerve surgery on my neck, and I have pretty much permanent numbness at the back of my neck because of, occipital nerves that were cut or ripped out. So yeah, when you mess with nerves, they go numb and they can stay that way for a long time. It happens to many, but not all people, I guess. I don't know, but yeah, numbness in the chin and the lips and in various parts of the face in general. Number two, apparently TMJ issues can be created by surgery, but I think that you hedge the risk of that happening by just choosing your surgeon wisely. Like, don't be operated on by an idiot, and that probably won't happen. Okay. It's not rocket science, right? Like, the TMJ health is determined by the position of the lower jaw with respect to the upper jaw.
So it'd be safe.
It's not rocket science.
It'd be safe to assume that if they were doing their job right, in the end there would be no TMJ.
Correct. That's definitely correct. Yeah,
Okay.
TMJ issues are not an inherent part of doing double jaw surgery. It's not like doing the surgery entails that this must occur. It's a fuck up, basically. And so I wouldn't assume that that's going to happen. Other risks are, let's call it 6 weeks of hell, and that's being very conservative.
So that's being very conservative?
Yeah, I would say it's probably more like 2 to 3 weeks of hell.
And so in that period, I'm drinking the liquid food out of a straw for like 2 weeks. And is that the process, right?
Yeah, pretty much.
I could bear with that. So right now I'm leaning more towards the jaw surgery.
Mm-hmm.
And so you're saying you go in one day, 6 hours, you're out, then for 6 weeks of hell. And then that's it.
And
The
then
other
I would...
concern is, so of course they recommend braces before and after. That's what I've been told for the longest time.
Correct.
Would you say that's necessary, or would you say Invisalign could do the same thing?
No, Invisalign can't do the same thing when it comes to double jaw surgery. So let me just step back for 1 second. In addition to the, liquid diet, and then let's call it 6 weeks of hell, there's going to be another year of general weirdness and discomfort as you get used to your new face and as your bones fuse up, because it does take, let's say, 6 months for the osteogenesis process to mature to the point where your jaws become contiguous again, rather than two separate pieces of bone in each jaw that are held up by plates, basically. So there's a 6 to 12 month weird healing period where you remain swollen, you look different, you look off, you don't look great, you talk funny, you're very susceptible to falling or whatever and making it way worse because it's still healing. So there's a year.
So like you could fuck it up in that period of time.
Just like if you broke your leg, right? Like if you broke your leg, you're not going to want to have a fall onto that leg for at least six months until it heals, right?
So like no Muay Thai in that.
No Muay Thai for a while, yeah.
Okay.
Yeah, for sure. What else? So, but you before I went off on that, what had you asked?
I do not remember.
Yeah, it was braces. You said, are braces necessary, or can Invisalign do what the braces do? So you could do MSE, right? And then as for your orthodontics, you could do Invisalign. But when it came to pre-op setup, like the weeks before the surgery, you need braces. Why? Because
so you're saying only the weeks before, but not after.
Well, even after, probably you're going to need it for a while. And let me just explain to you why.
2 years?
With braces, no, probably not. With braces, you only need to keep them on for as long as your upper and lower jaw are connected. Let me just put out this, explain how it works. When they do double jaw surgery, you need braces for this reason. They tie your upper and lower jaw together using the braces, and then they cut both jaws and they move them both together forward to coordinate them. The simplest way of coordinating the upper and lower jaws is to just tie them together. And so for that, braces are needed. Now, in your case, where you're going to be predominantly doing a maxillary advancement to correct that underbite, I don't know if that's going to be necessary for you. It probably will be, because what will happen is they'll move the upper jaw forward, and then they'll position it with respect to the lower jaw, and then they'll tie it together, and then they'll plate it, and then you'll be frozen in that position. So yeah, you'll probably need braces even for your type of double jaw surgery, although I have a lot to learn when it comes to double jaw surgery, and I'm not 100% sure about that, but probably, just from a common sense point of view.
On top of that, I would be doing the MSE right before, not after.
Definitely, if you're going to do an MSE, it's going to be before. Most of your orthodontics is going to be done before the double jaw surgery. Before surgery, you want to get as much orthodontics done as possible. Yeah, so especially MSE, you're not going to want to break the maxillary bone.
Have a underdeveloped maxilla when they bring my jaw back.
You're not. Well, what I was thinking, and maybe this is what you're saying, you're not going to want to, do a Lefort surgery, cut your maxilla off, move it forward, plate it in that new forward position, and then split it in half with an MSE.
Yeah, of course.
Yeah, that's just.
And you would definitely advise that I get the MSE in general before the surgery.
Would I advise that? I mean, so here's what I'll say. Your upper jaw is super narrow. Smile for me. I mean, it couldn't hurt, man.
Yeah.
And if it all depends. It depends on practicality for you. Like, if you can find an MSE provider, then go for it, right? Because
and so you'd say those two people will definitely have MSE available.
I know for a fact that the two names I gave you do MSE.
Okay.
But while we're on that subject, let me do a quick search for you for
Yeah, because I guess like
Toronto.
we have 5 minutes left. That's like the one thing that I want to be certain that I could actually have a plan.
Let me do a quick search for Toronto.
Yeah.
I've got two names that you can try.
Okay, I'm gonna write them down.
Okay. Mazen Hamadi, David Walt.
Perfect. And so, like, I know a lot of orthodontists do child's MSE here. So, are you sure that those make it like the website you're using makes a distinction between adult and child?
My list is so all of these names I give you are what I would call leads, which means that there's a good chance they'll be able to give you the MSE. These are all names that are associated with the MSE providing community. What I would recommend in terms of how to proceed, and this is a universal recommendation that I give to almost everyone, take the handful of names that I gave you and contact at least two, but hopefully three of them. Pay the money to consult with at least two, perhaps three of them. So we're talking, at least $1,000 just in consultations to gather more information. Then, after you get the information from the consults, choose your provider from that point on, because you will learn a lot by getting 3 consults, and you'll know where you stand with regards to how basically people are planning on treating you, and who's going to offer you something that is whose vision of what they want is aligned with what you want. So I would consult with at least three of these names that I gave you.
I honestly may stick my neck out and just contact all of them and see how much that may come to. But I appreciate it.
Yeah. Remember, an upfront investment in R&D, research and development, pays huge dividends in this type of stuff. Okay, so you always want to be willing to spend a little bit upfront to get more information. Because the names I gave you, I'm not super solid on them. So Sylvain Chamberlain, I know for a fact he does adult MSE. Okay, but he's 8 hours away.
Yeah, if I need to.
He's also a little bit, he can be tough to work with a little bit. I've spoken with him and, he's a little bit, he can be a little bit abrasive, but his work is very impressive if he's willing to take you on. And someone like you are not a fence case, bro. You are a slam dunk, guaranteed, like you need assistance from these types of professionals. Any of these people is going to be willing to treat you. So, take the list of names I gave you, and then let me add one more to the list for you. Okay?
Yeah.
Her name is Molly, Molly.
One sec. Molly. Yep.
Last name, Gareh. Gareh. Molly Gareh.
Gareh. Perfect.
Yes. And she's in Thunder Bay, which I know is far. But if, all of these people that I gave you are far. So just, add her to the list and you never know what you're going to find.
Okay. I appreciate it. I'm happy to have gotten all this information because I was kind of losing hope that I wasn't going to find anybody in Toronto or Canada for that matter.
Yeah. Last thought for you, man. And this is something we didn't really talk about, but it's worth discussing. You said, do I recommend an MSE for you at all? I think it's not unreasonable for you to just go right into surgery, honestly, especially if you can do it locally and not having to travel, across Canada just to see an MSE provider. In a case as, egregious as yours, where you have this huge underbite, it wouldn't be uncalled for you to just go right in to see an orthognathic surgeon to have that fixed. Now, if you do, you have to be extremely careful that the following does not occur. Because I've actually seen this.
Okay. I may actually write this down because...
Well, you'll get it. It's common sense. Okay. Just listen up. Just listen up.
Yeah.
Some surgeons, if you can believe it, to fix a case like yours, would cut your lower jaw and move it back.
Yeah, so that's what I've actually been told by most of the orthodontists that I've spoken to in Toronto is what they would do.
Yeah, no. No, for that.
Yeah, because that's kind of, I was looking into what you were saying and what Mike Mew and I think his dad were saying, and they were like, that's too invasive and that's not what you need. What you need to do is expand the maxilla, bring the maxilla forward, because that's what's underdeveloped. I'm not sure if it's that my lower jaw is actually overdeveloped or if it just developed and my upper jaw didn't.
No, it's definitely the latter. Your lower jaw is fine. It's just that, let me see what you look like from the side. Again. Turn. Yeah. Your lower jaw is fine. Your upper jaw is underdeveloped. Can we see what it looks like from the other side?
Yeah.
And just pause there for me for a little bit. Yeah, bro. That maxilla needs to come forward, without 100%. A doubt. So this is really the crux of the conversation here, is that you have to be careful, bro, that they don't cut that lower jaw and bring it back and make your airway even worse. Yeah, you would look more normal, right? Yeah. Because your upper and lower jaw would be coordinated, albeit they would both be recessed now instead of just the upper being recessed. But why bring the lower jaw back when you could just bring the upper jaw forward?
It's not worth it, is what you're saying.
It's not only not worth it, it's ass backwards. Because they're just making your airway smaller.
I knew a girl who did it, and she ended up not being able to breathe properly. So that's kind of why I started looking into other options, because I thought that was the only way they would do it. But you're saying if I went and got the double jaw surgery, there's another way. That makes me a little more optimistic.
So instead of getting your upper and lower jaw to match by cutting the lower jaw and bringing it back, they can get your upper and lower jaw to match by cutting the upper jaw and moving it forward. Then you have a bigger oral airway, more forward, better looking jaws, and you have coordination of the upper and lower jaw. Your underbite is fixed.
Perfect.
So if you do speak with surgeons, you better make sure that they're on the same page with you, same page as you when it comes to that.
From what you know, that first person that you gave me, Sylvain Chamberlain,
yeah.
They would never do such a thing as cutting the lower and bringing it back.
To be honest, I'm not even sure.
Know. Yeah, so I'm going to need to find out.
Look, bottom line, now you know what to look for. Go out and ask these Canadian guys what's up. If you get any shit from these guys about them wanting to cut your lower jaw and move it back, just come to the U.S., bro. It's not worth it. Save up the cash, come to the U.S.
100%.
Yeah. How? You said you're 23?
20.
Jesus Christ, bro.
Anyway,
you're wise beyond your years, brother. You're wise beyond your years.
Thank you. I really appreciate it, though. Seriously.
Okay.
Your account is doing gold.
All right, man. I appreciate you, man. I appreciate you participating with the channel.
Of course.
All right. You let me know what else I can do to help, okay?
Of course. I'm good for now. All right. All my questions have been answered, so.
All right, brother.
Thank you. Take care.
All right, man. All right, Jason. Be easy.
Peace.
Take care, man.